Governor Raimondo has signed into law a package of bills to help curb supplies of addictive painkillers and expand access to early drug abuse treatment. This is a move intended to fight the opioid crisis. And as much as I must applaud the governor for advocating this cause, I have to remind her that there is still much to be done, especially since the bulk of her bills are not combating one very important part of the opioid crisis, the market that wants to keep people addicted. Are you kidding me? This is a real thing, and people are making buckets of money off of other people's addictions. Raimondo's bill package includes legislation for health insurance coverage for anyone who wants to purchase the opioid antidote naloxone. This is a great start, but it is just that, the beginning. Much more needs to be done. Let me take, for example, one clinic that exists to help addicts get the prescription medication they need to be clean of their addictions, whether that's heroin, cocaine, painkillers, the list goes on. These clinics will get you off of drugs if you stick to the program. What you do is pay something like $55 a week for a visit, and then you pay for your prescription for approved drugs like Suboxone or Zubsolv. That cost depends on your health coverage, but let's say around $40 for the script. Now, some of these places allow you to pay a blanket fee of $185 a month, and then it just depends on paying your weekly script for your medication. One thing to note, Suboxone is a name brand drug while Zubsolv is a generic, so you can guess how the price changes between the two. Some people can wean themselves off, go cold turkey, use this as a temporary situation. But that's not everyone, particularly because drug clinics like this want you to be addicted to the treatment because of the absurd money they make. In fact, if you skip a week, you might face counseling, which really just means you are bullied into continuing with the program and paying your dues each week. And if you pay per week, you still only see the doctor about once a month. So what are you really paying for? There isn't always an in-house counselor or group therapy or much more than a standard urine test to make sure you're clean. And you might get charged extra just for skipping weeks. And if you can't pay these costs, well, they can refuse to give you medication you can't always get at other pharmacies. For example, your coverage may state that you can pay a lesser fee for your meds, but you have to get it at a specific pharmacy. Let's say Walgreens for funsies. Well, not every Walgreens carries these drugs, and even if they do, they can't exactly advertise it. So you have to literally drive around to every Walgreens until you find one willing and able to fill your script. So if you have to pay for the meds at the clinic without health care, what exactly are you supposed to do? Clinics like this are not all the same, but they absolutely are clinic operators that are legal drug dealers who make sure that you stay on these medications for life. Because just stopping a medication like this is not like giving up a multivitamin. It can actually ruin your life. So the next time you sign a bill to fight drug addiction, you better damn well make sure it's actually going to help stop addiction. Are you kidding me?